So Airstrip was created to improve the way we practice medicine, to really improve outcomes for patients using digital health. And Airstrip One is a platform, and it aggregates patient data across the continuum from inpatient, outpatient, post-acute, home sources, and puts it in one place, whereas physicians, we can access the data at the moment of care. And EHR is part of the platform, meaning, we take a variety of information sources and put it at the clinician's fingertips. One of those sources, of course, is electronic medical records, but our platform includes things like the live monitoring data, OB data, cardiology data, imaging, and then data from home, including sensor-based data and remote monitoring tools. So EMR is an important part, but it's one piece of the puzzle. What we're offering is a look into the continuum of care. Right now, it can be for any clinician. Where we started was in the hospitals and hospital systems. And so our clients right now are really, HCA, THR, large hospital systems, and then smaller hospitals that have a real pain point, have a problem, and that we can address with digital health. So I think in the future, as this type of technology gets more and more incorporated, and as we create this ecosystem of digital health, we'll start to include doctors' offices and then patients, patient-centric information, all into this digital ecosystem platform. All of this technology simply enables us to do our job better. I mean, can you imagine? I work currently in the Navy. I work in the VA, and for me to see information, although I have good access to information, but it's difficult. If I could have one platform where I see everything I need to know about that patient at the moment of care, that would improve my ability to treat that patient, and that's what we're getting at. There's certainly a lot of information out there, and when you create a platform, you can collect a lot of information. So you need tools that help you decipher that information into something that's valuable. And so we've incorporated tools like clinical decision support, analytics tool. We have a partnership with IBM that actually allows us to analyze continuous data in motion. So meaning we can take streaming data, put it through Airstrip, put it through the analytics engine, and put it out in a way that physicians can use at the moment of care. So your answer is yes, we're collecting a lot of data, but we're also making it actionable. I think the ultimate advantage of this, of the digital health and the platform, is to benefit the patient, is to benefit the care they receive. I mean, if you are a subspecialist clinician and you're seeing a patient with multiple comorbidities, and you have all the information you need at your fingertips to make a data-driven decision, that benefits the patient. And right now, we don't often have all that information at our fingertips. It's a platform, so it aggregates data across all these different areas, and one of those may be your outpatient EMR, as you're talking about, and incorporates it into this one platform with the user interface that's designed by physicians and is easy to use. So with that, you're seeing all of this information, but then you can share it among other clinicians. So if you have a patient with multiple comorbidities, you may have 5 or 10 different clinicians, physicians, who are seeing that patient. Here, you can have all that information at your fingertips, and then you can share the information among those clinicians. So really what it gets down to is this platform in digital health allows you to innovate, allows you to have a more efficient workflow as a physician, which again ultimately benefits the patient. It is incredible to be on the cutting edge of technology, and certainly, this type of technology is making a huge impact in the way we care for our patients, and that's exciting. And I think that was reflected in the discussions today and the panel. I mean, digital health is something that is here now, and it's going to be the way we practice medicine in the future.